It is a case that made headlines around the world. A pregnant Texas mother thrown in the middle of the abortion ban debate.
Her life was in danger, and doctors really confused on what they could do to help her. Health reporter Haley Hernandez looks at exactly how many women have been harmed and whether abortions have truly been eliminated. All new at 10 o'clock.
Inside this family-friendly neighborhood, this Austin couple was anxiously awaiting the arrival of their baby girl. But halfway through the pregnancy,
my cervix had prematurely dilated and my membranes had ruptured.
Soon after, Amanda Zarowski went into septic shock.
Knew that I didn't feel good, but I didn't know until much later when I was reviewing my medical records that the doctors, the nurses, the techs, they were all fearful that I wasn't going to make it through the night.
Sepsis is the body's extreme reaction to an infection. It can immediately start to damage your organs, and emergency treatment is necessary. But Amanda didn't get urgent care. Instead, she says her doctors didn't know if they could legally terminate the pregnancy that led to the rupture and infection in the first place.
Never in a million years did I think that it would apply to me. I mean, I was somebody who was actively trying to get pregnant. I mean, I had no idea that they could take it that far, and here we are.
In response, she filed suit. Zarowski versus Texas. The now famous lawsuit of Texas women suing the state has 22 plaintiffs. They argue without the right to terminate their pregnancy, their lives were in danger. This isn't the role that Amanda wanted. She's not an activist, but she says it's now a responsibility.
I intentionally and purposefully spoke out very early because the longer I waited, the more people would have suffered.
To get to the real number of abortions happening here in Texas, I had to come out here to Austin. And the numbers that the Department of State Health Services sent me reveal something surprising. Last year, during the first full year with the total ban on abortion, there were 131 life-threatening complications, even though there were fewer abortions happening. In 2021, there were 223 complications when abortions were completely legal, and there were thousands more of the procedure happening. That means there was an increase in the percentage of complications from less than 0.4% of patients experiencing complications to now more than 267%.
But I think what we're seeing in the statistics is that people are being pushed to the limit and having these complications, likely because of that.
Complications like 5 patients with sepsis, 34 patients hemorrhaging, and 1 death.
Which is extremely rare. I've never seen that in my career.
I mean, seeing more than 100 complications in 1 year, I mean, does that mean that where these women are going or what they're doing to achieve an abortion is now unsafe?
The problem, I think, is that, again, people are being forced to wait. I also see patients that are saying, you know, they weren't sure if they should come in, they weren't sure if they should wait, they weren't sure if they could go to the emergency room.
Since the ban, Texas has had 49 abortions compared to 52,495 in 2021.
They accomplished fewer abortions in Texas, but doesn't mean fewer Texans are having abortions. They're just going out of state. So they really just displace people and traumatize people.
And some say it's decreasing the number of medical students wanting to become physicians in Texas. The Association of American Medical Colleges found a 3% decline in med students to states with abortion bans. And the American College of Obstetricians and Gynecologists say future physicians are making residency decisions based on a state's abortion policies.
What about the people who are going to watch this and say, if that's what they want to practice, I don't want them here anyway?
We go to school for over a decade. We have a lot of training. We have a lot of information. And we want to be able to help the person that's in front of us, the human being that's there with a name and a story, and not have to think, what information can I say or can't say based on where I am? What things do I have to hide from my patient because a law was passed?
In Amanda's case, she didn't have the option for that care, and it basically ruins her chance of having another child.
One of my fallopian tubes is permanently closed from the scar tissue. My uterus had collapsed. He had to rebuild that surgically. And then on top of all of that, the condition that I had with Willow, incompetent cervix, because it happened to me once, it's more likely to happen to me again. And, you know, the law hasn't changed.
Agree with it or not, Amanda said she's not aiming to reverse the ban.
Just clarity to the way the law is written and what constitutes a medical exception and when can doctors act and when can they not. And honestly, that's the very bare minimum.
And looking past the lawsuit, she says there's still hope for her.
She took a piece of my heart with her that I'll never get back, but she replace it with her strength, and it's monumental.
Haley Hernandez, KPRC 2 News.
We have had an entire day of coverage on important health topics for women in our community.
That's right. On click2houston.com right now, you can find out about why more women are choosing to freeze their eggs. Plus, a popular women's health expert answers your questions about menopause and other hormone-related questions. We put all of these stories under the health section of our website.
And you'll